Now we'll start the steps for doffing of PPE. Key points to remember are: label low risk and high risk zone. Put all PPE in the leak-proof bins for infectious waste. Doffing of PPE only with supervisors of a trained observer. Recommended PPE for trained observers such as single-use face shield, available or cap, coverall or gown, single-use gloves with extension cuffs, single-use shoe cover. Remind health worker to avoid actions that may put them at risk, example, touching of face. Minimize touching the healthcare worker or his or her PPE during the process. Now we will start with the steps for doffing of PPE. Inspect PPE for visible contamination or tear before removing it. Disinfect outer gloves using 0.5% bleaching solution. Remove outer gloves. Disinfect inner gloves and inspect both sides of inner gloves. Remove face shield. Disinfect inner gloves. Remove cap. Disinfect the inner gloves. Remove gown very carefully. Untie the lace of the gown and try to pull out from the shoulders of the gown, preferably with the index and the thumb. Disinfect the gloves. Avoid contact of the scrub with outer surface of gown. Roll the gown, turning inside out. Touch only inside when rolling it prior to disposal. Remove Before removing the goggles, disinfect the inner and remove the goggles. Disinfect the inner gloves. And remove the shoe cover. Disinfect the inner gloves. Remove it and dispose. Perform hand washing procedure. Wear a new pair of gloves. Remove the mask with the head tilt slightly forward. Sit in Disinfect the gloves. Sit in the low risk zone in an area where your legs are in the high risk zone. Disinfect your shoes with the gauze soaked in sodium hypochlorite and rub your sole of the shoes on the cloth soaked in sodium hypochlorite solution. This gloves. Perform hand hygiene using alcohol-based hand rub. Inspect for contamination.